This is a presentation on body temperature from RNG. Today we're going to talk about the most important vital sign of the body, that is body temperature. Take a body temperature. Well, that will provide initial measurement that something is wrong inside the body, and will provide a baseline data to a nurse or a healthcare professional that the condition of the patient is deteriorating. Either the body temperature is increasing or the body temperature is decreasing. So it will give a baseline status that something going on inside the body of the patient. When we take this body temperature, so first of all, we're going to take when we have admitted the patient, when a nurse or a healthcare professional is going to perform a physical assessment on the client, either before or after an invasive diagnostic procedure, before after medication administration, before, after, or while doing blood transfusion to the patient, or as you entered or nearby the patient and you find out that the condition is deteriorating. You have to check the body temperature first. Or you know the patient is already on the isolation precautions, or either there's some kind of infection present in the client. So that will provide you the very baseline data that something is wrong with the patient or the patient condition is normal. Check the body temperature and why we're going to check it, but it's very important to know what are the instruments available nowadays with which you can come to know about the body temperature of the patient. So there are various kind of instruments or the techniques available with which you can know about the exact body temperature of the patient. For example, there is a glass thermometers, there's a digital thermometers, thermal radiation thermometers, there's a probe automated thermometers, and even if these of them not available within a time to a nurse, there is a one thing that is your hands. You're gonna check the body temperature with the dorsum of your hand. You're gonna get to know an idea that either the body temperature of the client is cool, warm, or hot. A nurse can use a dorsum of the hand to get an idea that the body temperature is normal or not. Normal body temperature of an adult patient or a client is 98.6 Fahrenheit or 37 degrees Celsius. When this mean range go below this level, the patient goes into hypothermia or a low body temperature, or the mean range goes above its range, the patient go towards the fever. It could be a low fever or a high fever, depends upon the degree temperature increasing. And this chart shows the ranges in which we can identify either the patient is going into a hypothermia, the body temperature is normal, or the body temperature is increasing way too high. There are two units in which you measure body temperature. First is Fahrenheit, second is degrees Celsius. So if your thermometer is showing the range in Fahrenheit, you can convert that into Celsius with the formula of degree Fahrenheit minus 32 multiplied by 5 by 9. You're going to get the mean range into the degree Celsius. And if we know the degree Celsius temperature of the body, you can convert it into Fahrenheit with the formula degrees Celsius multiplied by 9 by 5 plus 32. It's going to be equal to degree Fahrenheit. So it's very important to mention unit when you are writing the body temperature mean range. Now nurse gonna perform this procedure on the patient, but how she will do it? There are certain methods in which she's gonna take the body temperature. First of all is the oral, axillary, tympanic. She can check via rectal, by temporal artery, or she can check the body temperature by assessment of the skin. So let's discuss these one by one. Oral body temperature. For assessment of an oral body temperature, patient either is going to be lying on his bed, sitting on a chair, or standing. So for that, nurse going to place the thermometer probe under the tongue on the posterior sublingual pocket for full 1 minute. And it's very important to know there should be no restriction on the patient in which you cannot place thermometer in the mouth. That could be a oral surgery, any kind of a oral restriction. For example, the patient is on seizures risk, any oral infection, restricted to open the mouth, and it's very important that client should not consume hot or cold food. If he did, nurse should wait for 15 to 30 minutes before taking an oral temperature. And the mean range could range from 0.5 above or below from the normal 37 degrees Celsius range. For this, thermometer gonna be placed in a dry axilla, clear, and patient should able to move his arm or there should be no shoulder restriction. And the axillary body temperature is always lower than the oral body temperature. It's gonna be lower approximately from 0.5 degrees Celsius to 1 degree Celsius. And there should be no restrictions on the patient, like either is there any burn around the axillary area, movement restricted for the shoulder or for the arm, or any kind of a skin infection present, or any surgery done around the area, either it's a right side or a left side. Nurse gonna take axillary body temperature. For this, probe should be placed in the auditory canal of the ear, either right or left. And for that, first of all, nurse should know there should be no restriction, any kind of a ear infection present or a surgery done on that area or any kind of a burn around that area or any kind of a disease condition or the surgical condition in which you cannot place that probe in that particular ear. And she gonna measure the body temperature for full 1 minute, and the mean range for the tympanic body temperature is 36.5 degrees Celsius. artery body temperature checking. For that, the position of the temporal artery is going to be on the forehead, on the neck, behind the earlobe. It could be right side or the left side. Mean range gonna be 36.5 to 37 degrees Celsius, and you're gonna measure the body temperature with the probe for full 1 minute. Just know that there should be no restriction regarding to the headache or any kind of a burn around that area, skin infection present, surgery done around that area, or any head movement restriction. Body temperature checking. For that, the best position is Sims position, and you're going to place the probe in the rectum. And very important to know that you should not insert probe more than 1.5 inch or 3.8 centimeter in adults and 0.5 inch or 1.25 centimeter in an infant. You should measure the temperature for full 1 minute, and the rectal temperature is always higher than the normal body temperature. It's going to be 0.5 to 1 degree higher than the oral body temperature. Very important to note that there should be no rectal surgery done or either a risk of bleeding due to certain conditions. If the patient have any kind of a cardiac disease or a cardiac condition, you should not check the body temperature via rectal, or a fecal infection present. You should not gonna insert probe in the rectal area of the patient. You know that certain conditions impact the body temperature. For example, in the morning, body temperature is low and it gradually increases in a day due to metabolic activity. Activity level of the day gonna impact the body temperature of the clients, as well as environment like the cold weather gonna decrease the body temperature and hot weather gonna increase the mean range of the body temperature. Exercises done by the client in a day impacts the mean range because use of large muscles create heat and it will increase the body temperature. Age impacts the body temperature. For example, infants vary in the body temperature due to heat regulating mechanism not fully developed. Stress level increases your metabolic activity and it will impact the body temperature and gonna increase the mean range in the body. Pregnancy and menstrual cycle impact body temperature in the females. For example, while ovulating, the range increases to 1 degree Fahrenheit in the females from the normal body temperature range. Illness impacts the body temperature. Either it's an infection, any surgical condition, or a disease condition present. It's gonna either decrease the body temperature or increase the body temperature in the client. So it's very important to know which condition is present in the client when you are going to perform the procedure. At the last, it's very important that she should always document and report the abnormal body temperature findings to the doctor. Either it's a low body temperature, it's a normal body temperature, or it's increased body temperature. It should be documented and reported to the healthcare professional. Temperature assessment. In the next presentation, I will talk about pulse rate assessment. Thank you so much. Hope you have liked my presentation.